The resurgence and spread of Mpox has health officials worldwide on high alert. At least 13 countries in Africa have reported cases of the disease. Joining us live from Brazzaville, Congo is Dr. Matshidiso Moeti, the WHO Regional Director for Africa. Dr. Moeti, thank you so much for joining us today. How concerning is the Mpox outbreak with cases spreading now in Europe? And what are the main challenges in managing it across different regions in Africa?
Yeah. Thank you very much for having me to talk about this very important subject. You know, I think the declaration of Mpox as a public health emergency of international concern by the World Health Organization and also of continental concern by the African Centers for Disease Control of the African Union underscores the seriousness of the outbreak and, more importantly, the risk for international spread both within Africa and beyond Africa. We've now been told that there is a case in Sweden and also a case in Pakistan. So it just underlines then the importance of working together across countries and across continents to make sure that we contain the spread of this virus. If just coming back to Africa, you know, this disease has been endemic in some areas, but we're starting to see in Eastern Africa, particularly around Kivu, spread to new countries, neighboring countries like Burundi, Rwanda, Uganda, and there was one case in Kenya. That underlines the to new countries, even in Africa. And under these circumstances, we may find in very faraway places healthcare workers and healthcare systems that are not expecting Mpox, may be unaware what this is, and therefore enable and allow the spread to go further. We may also find populations that have been exposed before that don't have any level of immunity to this virus and get seriously ill. I think all of this underlines the fact that not only in a region of Africa where we have the epicenter in the eastern part of the Democratic Republic of the Congo, but globally, we need to be working together to raise awareness, to mobilize the resources, to increase the preparedness of people, health systems, and countries to recognize that Mpox has arrived. The virus is sometimes changing so that it's affecting different population subgroups, so that we work globally together to contain this virus.
And Dr. Moeti, speaking of resources, vaccine availability has been a challenge. A country like Nigeria has been dealing with Mpox for a few years now with no access to vaccine. Who is supposed to be vaccinated at this point, and what is being done to ensure equitable access?
Yes. I mean, clearly the most at risk people, starting, I would say, with the healthcare workers who might get into the first contact with somebody who presents at a clinic or a hospital and they have to nurse them, are really the first, the most important people to vaccinate. So frontline health workers, frontline responders need to be protected so that the health systems then don't collapse under the weight of this virus as it spread. And then secondly, of course, people who are closely in contact with cases within families and household members, intimate partners, should also be vaccinated. There are some people who have health conditions that make their immune system compromised. People living with HIV, for example, particularly those not on treatment, may also be more susceptible to severe illness if they get Mpox. So the issue of access to vaccines is something on which we are working collectively at the international level, WHO, the Africa CDC, other partners. And this really is a case of negotiating with the pharmaceutical companies that are able to produce this vaccine to ensure that they scale up their production and increase the availability of vaccines. Of course, that also means working with funders who would then be able to finance access to vaccines.